Hello, it's Jamie, and I'm now 2 years on testosterone. I really want to talk about my upcoming chest surgery, which is actually in 5 days. I'm really excited. I'm not sure if on my last video, I never really watched them back, so I'm going to ramble on about it again just in case. But a couple of months ago now, I went for a consultation with Dr. Shaw, who was my second opinion. I started off with Dr. Caddy in Sheffield, and I just wasn't happy with what he was going to offer me. He wanted to do anchor incisions, and from people I've seen and what I've heard, that's the worst kind of chest operation you can have, kind of thing, to take away breast tissue. If you've got larger breasts like I do, it's just you don't get a very good result. You still keep a lot of the breast shape, whereas I suppose if you've got smaller boobs, then maybe that'd be better. So he said that the only operation Dr. Kenneth said the only operation he could do was the anchor incisions. I kind of got nowhere. I waited around for a year. And then a few of my friends had gone to Dr. Shaw in Hull at Castle Hill and said that it was amazing. I'd seen photographs and he was amazing. So I basically rang them up and said, can I be seen by you instead? Rang up a gender clinic and they referred me over to Dr. Shaw. I got a consultation within about 10 weeks. Went to go see him and it went really well. He measured me up, he talked me through all the options. He had a range of different ways of doing surgery if I wanted it. The first consultation, I got a date. He was really good to me, and I'm confident that he's going to do a good job of me next week. I went for my medical last week. Basically, that was just like a couple of swabs. There's one like just down your groin, which is just down like your pant line bit there. Not a scary swab. And then a swab up your nose just to check you haven't got MRSA. Then there was a blood test, and then someone just came and sat me down, talked to me about the risks and preparing properly and taking care of myself afterwards, kind of thing. Went through some paperwork, that was fine, and now I should be going in on Monday the 17th, which is Monday coming up. Today is the 12th, and I'll be going in at 8 o'clock in the morning and be having my chest surgery, and I'm having the double incisions with 3 nipple grafts. So that's the big long scars here, and my nipples were taken off, reshaped, and sewn back on. So I'm really excited for that, and I'm rubbish at keeping up to date with videos, as you probably all realised by now. But I'm going to try really hard. I'm going to take as many videos as I can, especially over the first 2 or 3 weeks once I've had surgery, so you can kind of see how it develops. Because I find that there's not that many videos out there where it's like 1 or 2 days post-op, and for me that's something that I'm really scared of. I'm scared of like 1 or 2 days post-op, like what's the pain going to be like, what's it going to look like, things like that. So if I can, like if I'm not sleeping, then I will try and get some videos done. I'm not sure when they'll be posted though, because I have to connect my phone to a laptop and it takes ages, but I'll do my best. So yeah, I'm really excited for that. And yeah, any questions about consultations, or if people are interested in Dr. Shaw, please email me, because I could just go tell him basically. So I'd love to help you out. Also, I think once I've had my chest surgery, I'm going to do a binder giveaway. Basically, if you want a binder, if you need a binder, please message me, email me, anything. Just let me know. I'm a size extra large, so I've been told that my cup size is about a D or an E, but I've never had a proper bra, so I don't really know properly. I've never been measured properly. But then in t-shirts and stuff, when I'm binding, I'm wearing like an extra large. So hopefully that'll give you some idea. I'm sorry I can't be more specific than that. But if you have looked on Underworks before, like the Underworks binders, if you've looked at Underworks before, then you'll kind of maybe know what size you are. I've got 1 black extra large, and then I've got 1 white XXL and 1 black XXL. And the XXL ones, the white one maybe a little bit faded, but definitely wearable. All of them are definitely wearable. I'll wash them before I post them out to you. So just get me messages, and I'll do my best to message them and give you them away as soon as possible after my surgery. And as well, like if you are the lucky person that gets one, then I'll make sure I message you before I post them, just so you know like when to expect them. Because I know like posting overseas sometimes it takes a long time, but I'm willing to pay for that, like postage and stuff. You know, I know that when I got my first binder, it was a really big thing, and I couldn't afford one, and they're really, really expensive, like they're £35 new, and then the shipping. I appreciate it's really expensive, but I know there must be a lot of guys out there who you know, can't really afford one, or are binding with, you know, like bandages and things like that. And it's so dangerous, and even though that the underwear binders, they still hurt, but it is nothing like any of the other stuff. So if you're interested, please give me a message, and I'll do my best to help. Also, I'll give you a little talk about 2 years on T. I suppose I've not really noticed a great deal of changes over a few months now, because everything's kind of settled down, and just slowly, very slowly, things are happening. Like, slowly getting more and more hairy. I don't even know how that's possible, because I'm already looking like Chewbacca. But then, yeah, still getting hairier. I'm hoping that this bit of my chin gets some beard soon, because that's pretty much the only bit left. I'm still not very capable of growing a very good moustache. But then, yeah, November was a complete failure. But all of this kind of growing now. I'm doing well. In terms of body hair, that's definitely going wild. My body shape has changed immensely over 2 years. Like, I've gone from having really big hips, looking like a cute little girl kind of thing. Well, not little, I was never little, but, you know, got like a cute girly face to hopefully, you know, a bit more of a manly face. My face has definitely changed shape. My voice has definitely changed. Like, the way my body distributes fat has definitely changed, and not muscly, but kind of like muscle tone is different. Like, my arms are getting a lot more muscly and bigger without me really having to do anything, and things like that. I mean, I'm still worried about my testosterone levels. Apparently, they're still quite low, and I'm on the Navido, which is, you know, really, it's a really, really high strength. And I used to have the Susten every 2 weeks, and I moved up to Navido to try and heighten my testosterone levels, and it's worked a bit, but there's still a bit of a gap there. So hopefully I'll get that sorted soon. I've not really had an appointment with Nottingham Gender Clinic for quite a while now. They're fantastic for me, and they kind of just said to me, you know, wait till you've had your chest surgery and then get in touch for an appointment. In the meantime, if I had any questions or wanted to talk to them or see them, I could arrange an appointment anytime. But I kind of got to the point now where chest surgery, that's my pinnacle thing. Like, you know, I'm looking forward to reaching that, and once I've reached that, and when that's happened and I've healed a bit, then, you know, it'll be time for seeing what's going to happen next, really, which I'm probably thinking hysterectomy, but I don't know. That's a whole other video waiting to be done. What else? I've been trying to apply for my gender recognition certificate. I've not actually got it sent off yet, but I've got all the paperwork done. I've got my evidence together, and I've been to solicitors to get it sworn. So it's pretty much just ready for me to send off now. I'm really excited for that, and hopefully, fingers crossed, I'll get that first time, because otherwise you've got to apply every 6 months, and luckily because I'm a student I don't have to pay, but it's still like a big thing to do every 6 months, and, you know, I want it sorted. And I want to be legally male, so thank you very much for watching, and if you've got any questions or anything you want to know or anything I can help with, and especially the bind stuff, you know, just message me. I'm pretty good with messaging people back, do my best, so no worries, and hopefully see you soon.